Welcome to the channel Nursing in Handy. This channel is preferably for the nursing fraternities to have a continuous learning in their profession. So, are you ready to watch the video? So, without wasting much time, let's get started into the video. So, before that, like it, share it, and subscribe it, and let's get started. So, today's topic is about mumps. So, mumps is a contagious disease. That means it is a communicable disease that spreads from one person to another. So when we consider about mumps, it is not a very serious illness or disease because it gives you a certain symptoms like fever, parotitis, or stiffness of neck. So it gives a lifetime immunity for the child. So let's get started. Definition: mumps is a contagious disease caused by a virus. It can cause painful swelling in the parotid salivary glands, that is parotitis. So mumps used to be a very common childhood disease. After the mumps vaccine became available in 1967, the number of cases reduced significantly. So when we started giving the vaccination for the mumps, that is now we give a vaccination, that is MMR vaccination. So what happens, there was a gradual decrease of this mumps after introduction of the mumps vaccination, that is by 1967. So we'll see what is the incubation period is. The incubation period, what is meant by incubation period means it is a time between the infection and the illness. So it ranges from 7 to 25 days. So causes, so it is caused by a virus. That virus is known as paramyxovirus. So the infected person can spread the mumps virus by sneezing, coughing, or talking. So sharing the objects containing infected saliva. So children used to put toys or any things in their mouth, no? So if it is being transferred to other person, what happens, these through this droplet or through this saliva, it gets transmitted. The mumps get transmitted from a infected person to a healthy individual. Next, by playing sports or having a very close contact with the children's, like dancing activities or sharing the toys, cups, everything, it is one of the causes of transfer of this paramyxovirus from an infected individual to normal child. So symptoms are, first is fever, headache, muscle aches, fatigue, and loss of appetite. So they will not have the appetite, they will not have the feel of eating food. So other main symptom is parotitis, that is it can be either one sided or double sided, that is swelling of the parotid gland. So the classical sign of the mumps looks like chipmunk cheeks, because the cheeks puff up and the jaw swells. So you can see here the chipmunk, how it is, the cheek is being very puffy. So the same way, when a child is having mumps, the child also looks like a chipmunk face. Either it can be either single sided or double sided. So other symptoms like high fever, stiff neck, severe headache, confusion, stomach pain, vomiting, and seizures. So you can see by this GIF that either this chipmunk face we have said in the classical sign, no. So that parotitis may be either single sided or double sided. So it is either unilateral or bilateral. Next is diagnostic evaluation by through physical examination, that is by through inspection itself we can identify the child is having mumps, or we can go with the throat or the cheek that can be sent for a sample to identify what is the causative organism, whether it is a paramyxovirus or not. Next is management. So specifically for the mumps, we don't have any specific treatment. So this disease, once it occurs and it creates some signs and symptoms in the individual, then after a couple of weeks it fades by their own. So mumps treatment focus mainly on alleviating all the signs and symptoms they have. So we have seen like they have the fever, cough, or stiffness of neck, or loss of appetite. So based on the symptoms we give the management. That's why it is a symptomatic management can only be done. So other management which involves drinking plenty of fluids, gargling with warm salt water to reduce the swelling or throat pain. Next, we have to provide easy, soft, easy to chew foods, because since they have the swelling, they have pain, so it is difficult for them to chew the hard foods. If they are chewing the hard foods, it will induce more pain. So we have to avoid acidic foods, because acidic foods creates more saliva in the mouth. and ask the child to suck on ice pop to soothe the sore throat. Place ice or heat packs on the swollen glands. So you have to administer non-aspirin medications like acetaminophen or ibuprofen. So next is prevention. So prevention, the main prevention in the mumps is we can go with the vaccination. So we have to administer the 2 doses of MMR vaccination as per the national immunization schedule. So this is the only preventive measures we can do it. Or other preventive measures, like if we find any child is having mumps, we have to prevent the child playing with that infected child for a particular period of time. Next is prognosis. If we talk about prognosis, if a child is affected with mumps, they will not get the mumps again in their lifetime in the future. So that's all about the topic. If you feel this video is useful, like it, share it and subscribe it, and thank you for watching.